With a flashcard, you look once, and if you're studying efficiently, you look again in an hour, and then maybe again in another hour. And with that spacing, you reinforce what you learned. Accelerated TMS does the same thing. And so by treating you with TMS for 8.5 minutes every hour with 50 minutes in between, you learn how to be not depressed more efficiently. And that's how we're able to help get depression to remission rapidly. TMS treatment uses Michael Faraday's law of electromagnetical induction from the 1800s. The thumb in the direction of the wire, the fingers curl in the direction of the magnetic field, and the current is induced in the wire. And that's the same for the wires that are the neurons in your brain. Any orchestra trying to perform needs a great conductor, and TMS is the conductor for feeling well. We get your brain back in sync with itself. The brain's natural language is rhythm, and so the rhythm we use is crucially important. But the spacing between that rhythm is also crucial to helping get a sustainable effect. And so by changing the pattern of stimulation, we act like a metronome. The side effect profile for transcranial magnetic stimulation is mild. During the course of treatment, you can feel fatigue, headache, jaw pain, because we're making the neurons in your scalp fire, and that can make your jaw move or give you a headache. There can be some scalp tenderness because the coil actually creates a sensation on the surface of the scalp. And that can be uncomfortable or even a little bit painful at first, depending on your motor threshold. The only permanent side effect that we know of from TMS that's bad is tinnitus. That's a ringing in the ears. That can happen because the noise can be very loud. And so for some people who are treated at a higher power, we use earplugs. So you just protect your hearing and you don't have the problem. Another rare side effect, at worst 1 out of about 30,000 treatments, is seizure. The seizure is induced if it occurs, and it doesn't mean you have epilepsy, but it's an extremely rare side effect. It's about 2 orders of magnitude less than the risk of seizure with something like Wellbutrin or Prozac. The difference is with those treatments, you might have that seizure anywhere, and here it would be happening right in front of the team in the doctor's office and only lasting as long as it takes to hit the stop button. We measure what's called motor threshold every single day, and that's how we calibrate the energy we're using to stimulate your brain. If this was a medication, it would be the dosage, and it's customized to you. So the first step in TMS treatment is brain mapping. We're moving around the coil. Sometimes that's a helmet, sometimes it's a figure of 8 coil, and we're finding just the right spot that can make your thumb move or your foot. And we use the threshold, which is half of the time your thumb or your foot moves, depending on the placement, to calibrate the right energy. And that's called the motor threshold, because it's making movement from your motor cortex half the time. And that's how we get the right energy every day. After we've found the right spot and the right measurement for the dosage, then we can give a treatment. The treatment is repeated pulses of energy, and in theta burst stimulation, that pattern is triplets. That pattern at 50 hertz, cycling 5 times every second with pauses in between, it turns out that's the same natural rhythm of the brain. We learn that from measuring neurons firing in the hippocampus of a brain. And we give that same pattern back to the brain and it learns more efficiently. So each theta burst, as we call it, because 5 hertz theta, burst all at once. So we give that to you for 8.5 minutes with 7 seconds in between, and then we pause for 50 minutes. And that is the most natural rhythm for the brain to resynchronize with itself. The problem in depression or OCD isn't having the wrong brain or the wrong feelings, it's them being out of sync with themselves. And so just like you don't make a band better by replacing all the instruments, you don't make your feelings better without practice. And the practice your brain needs is this pattern. The effects of TMS from accelerated treatment can be noticed by some right away. And so at the end of 5 days of treatment, many people will have a full remission of their symptoms. Some people's brains are less acceleratable. You can't hurry them up. And for those individuals, after 5 days of accelerated treatment, from our research, we know that 7 days later, a group of people, about 10% more, will be in remission. And 3 weeks after that, so 4 weeks after concluding treatment, there's another group of people, about 10%, who are in remission of their symptoms of depression. That means depression is over, not 50% better, which was the standard we used for medication. And so by the end of a course of accelerated TMS for depression, 79% of people have remission of their depression symptoms. A fair question, how long is this going to last? And what we understand is the durability is personal, but on average, it's between 12 and 18 months. Some people benefit from treatment more frequently. Some people can wait and get a retreatment in a year or so. It's safe, causes no permanent changes in brain functioning, and effective. It doesn't require any medications. Obsessive compulsive disorder can also be treated with TMS. And we use a different target in the brain. Instead of here on the left, we move using a different coil here to the middle. But we use that same pattern, and we're stepping on the brakes of your worries. The way we make this more efficient is we actually will instruct you to do some of your worrying during the treatment if you're not worried enough. Usually this is not much of a problem at the beginning, but as treatment goes on, we find that people need a little bit of help getting more and more worried because the treatment's been working. One of the things that we don't know yet is how much TMS is the right amount for anybody. And historically, I believe the research suggests we've underdosed the treatment. More is better. And more can mean more treatments or over more time. And so for some people, after that accelerated course, we'll continue twice a week for up to 12 weeks after to get that full remission that everybody would prefer. Targeting with TMS is an important concern. And so your doctor will be making an evaluation based on what you tell them and the information we have in the chart. This allows us to work out where is the most likely treatment for your depression or your worry, and then target it using either one of our H-coil systems, which looks like a giant helmet. We have the H1 originally in depression, the H7 originally in OCD, also in depression, or even the H4 coil, which we use for smoking cessation and may work for other indications as well. The figure 8 coil we target using an fMRI, or functional magnetic resonance imaging. And because that coil is more focal, it only targets a tiny area of brain, about a cubic centimeter, we need to make sure we're hitting the right spot. And so we use a MRI scanner to find the right spot based on your brain talking to itself. And looking at those relationships between the depressed part and the rest, we find exactly the right spot for your depression, your obsession, or your trauma. And that's the strategy with transcranial magnetic stimulation and a comparison between H-coil systems, which use a larger array in a helmet, and a figure 8 coil, which we target with functional magnetic resonance imaging.